I'm Dr. Violet. Welcome back to Pharmacist and You Help. Okay, today we're going to talk about cardiovascular diseases, and we are hosting Farm Dr. Vincent Majobi. Do well to learn from this. You know, cardiovascular diseases are one of the most leading cause of death in the world. Cardiovascular diseases, there are so many, in the sense that they have so many differences and they attack in different ways. They are being treated differently too. So try as much as possible to learn, gain the knowledge. Is very important. And please do well to subscribe to this channel, like this video, share it, and also screen other videos. Open your ears, open your mind, open your heart to understand and learn from this topic. Thank you so much, and stay back.
My name is Vincent Majobi, and I will be talking on Introduction to Cardiovascular Diseases. Today on Pharmacist and You Hub, cardiovascular diseases are those conditions that affect the structure or function of the cardiovascular system, such as abnormal heart rhythms, Marfan syndromes, congenital heart disease, coronary artery disease, heart attack, cardiomyopathy, heart valve, vascular diseases, stroke, and so many other cardiovascular diseases. We will be discussing on some of those cardiovascular diseases. Abnormal heartbeat. The heart is an amazing organ in that it beats like 60 to 100 times in a minute. That's like 100 times in a day. So abnormal heartbeat is any beat below 60 or above 100 beats in a minute. So doctors call abnormal heartbeat as arrhythmia. And we'll talk about congenital heart disease. Congenital heart disease are those heart disease in parts or in some parts of the heart or blood vessels, and it begins before birth. Don't really know much what causes those things, but some facts have shown that exposure to some infections, alcohol, exposes a child to those congenital heart disease. Strokes happens when something blocks the blood flow to the brain, thereby inhibiting or blocking the brain from getting oxygen and some other nutrients for it to function optimally. So when this thing happens, brain cells doesn't get the necessary nutrients. They start to die, and thus causing a lot of damages to the certain parts that the brain controls. Stroke actually is one of the leading disability in this country. A lot of older people come down with stroke. Cardiomyopathy is the disease of the heart muscle. It's also called enlarged heart. People with this disease have thick and very thick heart, which impedes the heart to pump blood normally. Sometimes cardiomyopathy, most of the time, is genetic, and if not treated, it can get worsened. Heart failure. I know when people hear heart failure, they are scared, how my heart is failing. But actually, what heart failure is all about is the inability of the heart to pump blood. The heart will retain salt and water in the heart. So this leads to shortness of breath and the heart not working at optimum. So there are so many things to talk on cardiovascular. I believe we'll be talking more on the next series. Cardiovascular disease is one of the top leading diseases in the country and in the world in general. So care must be taken to take care of your heart, take care of your cardiovascular system to improve and increase your quality of life. Thank you very much.